Assalamu alaikum, you're watching Healthwise and I'm Dr. Tahira Shahid. We all have in our lives that one incident, is either it's a traumatic incident, an accident, a heartbreak, that we suffer for the while that it lasts, but it just doesn't end there. After that, many years later, we still carry its brunt. We carry its imprint on our souls, and it reflects in our personality, in our body, in our lifestyle, in our behavior, and so on and so forth. We have been living the pandemic for the past 1.5 years. Almost everybody we know either got corona, is suffering from COVID, or has recovered from COVID. But COVID didn't end there. It took the lives of those it had to take, but it also stayed with those who recovered from it. And what exactly is this post-COVID syndrome? What are all the things that we are noticing? Brain fog, insomnia, forgetfulness, extreme fatigue, joint pains, and so many more unusual things. To discuss this long haul syndrome and post-COVID syndrome, we have a very distinguished guest with us. He's my personal favorite, a very jovial and yet very, very accomplished doctor, professor of neurophysiology, Dr. Rao Suhail. Welcome to the show, Dr. Rao. How are you? And thank you for joining us today.
Thank you for inviting me and wishing you a very happy and blessed Ramadan Sharif. And we have a talk today, post-COVID syndrome. You know that pandemic is going on for the last 1.5 years, and it is affecting more than 3 million people over the globe, and still going on. So it's a very killer disease and invisible enemy which is killing all the time. So usually this all started 1.5 years ago. The virus which is called Chronovirus, and it has very similar shape like SARS-1 virus, and it is called SARS-2 or COVID-2 virus because of its spikes protein which is shown on the outer side of the virus.
So that green thing that we see, and we see those spikes coming out, those spikes
yes,
are actually the spike protein.
Spike
and we understand
protein.
their importance when we study all these vaccines and everything, right?
Yeah.
Okay.
So, and most of the patients who suffer from coronavirus, they recover within 2 months. But we have seen many patients who had this problem about a year and a half ago, and they are still suffering from symptoms like headache, shortness of breath, and loss of taste, smell, and hearing at times. And also they are suffering fog phenomena, as you rightly said. They cannot concentrate, they have palpitation, they have anxiety, insomnia, and so on, many things. So what is the problem with them? Still a debate is going on. Patients who are suffering COVID syndrome after 3 months, they are called post-COVID or long haul syndromes. There are many factors which are affecting it. Lately, they have calculated that the 10 to 30% of the patient who had coronaviruses from post-COVID syndrome. The scientists are thinking that it may be due to the fragments of the viruses in the body,
so
which are still staying in the body. Okay. And when they have vaccinated these patients, they showed improvement.
So vaccine does improve these remnants of the disease inside us?
Basically, the vaccine in the second dose creates antibodies.
Right.
Initially is an innate response. Second response is the memory response or antibody response, which kills the virus properly. So when you had a second shot, antibodies, they recognize the enemy or antigen and they attack that. So that kills it, and that's why most of the patients who are suffering from post-COVID syndrome, they improve.
But it's also believed that staying in a chronic state of inflammation, because all these organs were inflamed and we had a cytokine storm and an extreme inflammation response during COVID, that could also be one of the reasons for these post-COVID syndromes.
No, that response is usually initial response,
okay,
innate
so it's
response.
Not a delayed response.
That antibody response is delayed response, which occurs after 3 weeks.
All right.
So
So what should
this
we
is the
do for this, this sudden forgetfulness and, insomnia or feeling extremely sleepy or that brain fog where you can't concentrate? What do you suggest as a neurophysician? How do we help people who have these symptoms? How do they improve themselves?
So initially we have to treat the symptoms
Okay.
accordingly, and we should know the cause why it is occurring. One thing I have told you just now, and we should get vaccinated. And the second thing is that we should exercise ourselves. We should have a lively livelihood, and we should take our food properly, and we should walk with the family. You should also enjoy your life, not
This is
you
a
should.
very important topic, and actually, we were discussing this even backstage right now, that we should enjoy our life. The problem is we've attached fear to everything. We're so terrified all the time, and we're so stressed that the stress is actually causing us more harm than
more
good.
harms, and this is also one of the cause of fog phenomena, which the patient he has the problem in concentration, and he cannot remember things.
Right.
So there is another thing which is very interesting. I would like to tell that they have research on this fog phenomena, and they have concluded that it is caused by the one of the cells, premature cells from bone marrow, megakaryocytes, which stuck in the small vessel of the brain, and that causes the
Okay.
problem. So,
So it's a bug in
this
your
is
brain.
a storm, initial storm, which creates larger cells,
Okay.
which is stuck in the vessel, small vessel of the brain.
So some sort of memory exercises, some
So
sort of
yes,
mental
yes,
games,
mental
puzzles, playing
game,
games
and
with your
yes,
children.
enjoyment, and also learning and new thing learning, and you should exercise your brain regularly in small patches. Not you should read a lot of things, but in patches, small segments of the time.
So
So
you've
then
heard it
you.
from the neurophysician himself. He's telling you to take it easy, to be light on yourselves, to indulge in activity that really makes you happy. And what better time than Ramadan, when you can, get together at your
Yes,
iftar
yes,
or your sahur and talk about good things and exercise your minds, like memory games. For example, you're passing a place and then you try to recollect all the things that you saw.
Yeah.
What about the headaches? A lot of people are complaining of headaches, and plus now due to the dehydration and everything, they have even more headaches. What should they do about this?
Headache is very serious and common, most common symptoms of coronavirus. It could be a thrombosis in the brain, which is causing a problem. Also, we have to rule out whether patient is not having higher D-dimer, which is causing the clotting system in the body. And also we should go for the MRI to see whether there is no infarct in the brain or sort of
This
things.
D-dimer
So
is a very important
yeah.
test, and a lot of people were suffering these sudden heart attacks all of a
Yeah.
sudden, and everybody was out there saying that it's due to COVID. So what do you think, D-dimer, the connection, what is it?
So would like to clear one thing here. Most of the patient from coronaviruses, 80% of, they have mild form of coronaviruses. They don't need admissions in the hospitals and ICU care. But 20% cases, out of them, only 7 to 8% they need ICU care. The moderate to severe cases, they have to check their D-dimer, so that we should know there is not clotting going on. So most of the time, if we see the patient, they have normal D-dimers in mild cases. But in severe cases and in moderate some cases, we have high D-dimers. So initially, we have to exclude the cause of the headache. If there is no organic cause of headache, like thrombosis or like clotting phenomena, so then we have to treat symptomatically. And also sometimes depression, anxiety, this also creates headaches, and we have to deal accordingly.
Indeed, we are a very depressed society these days. Wherever we see, all the news that we are getting is also so depressing, and people keep scaring each other, and they're so judgmental about, oh, this person isn't wearing a mask, and they keep, passing verdicts and everything. What do you have to
Yeah.
say about that?
But you should not care about these things, and you just should enjoy your life And also you should not go in crowded places, avoid cooped up areas, and you should ventilate your rooms, also your houses, so that you should not get this. There is also debate going on whether it's a through airborne infection or not. So sometimes it can be through the viruses in the air, somebody sneezes and like this. So then you can get the virus, and new variants are which are the mutant concern viruses, which are not affecting directly nasopharyngeal area. They directly go inside of the lungs and attack it. So that is a serious thing. So we have a mutant form of concern right now in the world. 3 Brazilian form and Japanese form, you can call it, or this South African and UK form. So these are.
But there was such a controversy when a president called it, when a US president called it the Chinese virus. So we can be calling it the UK variant and the Brazil variant is okay.
So there is no proof about it, but it initially started from one Chinese city,
so that is
but still not proven that initially it was. It's like flu virus in 1980, first pandemic of viruses started in 1918. Flu, which killed about
the Spanish
15
flu, I believe, right?
Yeah,
but
which killed about.
But sir, I really want to ask this question. Like, this was 100 years ago, and there you see them wearing masks and practicing social distancing. In 100 years, we've progressed so much. We have 4G and 5G and whatnot, and still our approach remains the same. Why is that? Why haven't we changed in 100 years that now we should have something else, right? It should have been more.
So you talked about the technology. I would like to mention here and would appreciate the technology. That time, virus killed about 50 million people, and 2/3 of the population of the world affected by this virus. And now it just crossed 3 million people in the world. So you can well imagine the killing, how technology saved it, because you just message and it will be all over the world. So it can save a lot of lives.
But at the same time, this message phenomenon where people keep forwarding messages creates a lot of fear in people as well, a lot of negativity, a lot of self-medication.
Yeah. But you should also read material which is authentic, for example, through the doctors and specialists, and you should not heed upon
just believe everyone
and people around you, and you just should.
So the key is to keep a good immune system, to eat well, to exercise, to stay happy. And if you have any of these post-COVID symptoms, whether it's joint pains or it's headaches or it's memory loss or it's rashes like COVID pose and all of that as well.
Tingling sensation in the body and neuropathy and
loss of taste and smell.
Yes, sometimes it kind of. Our doctors, they are having these problems and they do not wear mask and spreading disease.
No, we are not spreading disease. We're all vaccinated.
Unfortunately, I have seen my colleagues who are well educated and still they are not wearing masks and they are not keeping distance.
But I think probably it's because you keep such a good environment at your workplace that they trust you, and the way you keep everybody happy and you keep them, all the time healthy, and that's how it is. So coming to vaccination, which is a very important topic, and there's so much confusion surrounding vaccination. People don't know as to what is this vaccination menu. We have like Pfizer and Moderna, that's an mRNA vaccine. Then we have AstraZeneca and Johnson & Johnson, and now Sputnik, the Russian one, and these are viral vector vaccines. And then we have CanSino Bio and Sinovac and Sinopharm that we are already getting, which is the conventional vaccine. So now could you please explain to our, all our viewers, because they have a lot of confusion regarding if they should go for vaccine, and many people think it's the treatment, whereas they don't know it's not the treatment of corona, it's a prevention against corona, and it's very important that they actually get it. And which one should they opt for? Which one is available to us? For us right now, we have the Sinopharm, CanSino Bio, and most likely Sputnik.
Yes, rightly said. There are many vaccines in the world right now. Some are causing clotting system in the brain.
AstraZeneca and Johnson's.
Notorious one. And but would like to say that most of the vaccines are giving protection against more than 85% efficacy they are showing. So some are showing 92% like the
Pfizer and
Moderna, and also Sputnik has shown 92%. Lately, Lancet has mentioned it is one of the best vaccine in the world. So, but they do not cover all sort of mutations of viruses. But lately, 2 days ago in Virginia, the scientists have discovered a new type of vaccine which are going to kill all the birds with one stone, and which they have created from the fusion protein. As you know, the outer side of the coronavirus has spikes, and it attaches with the fusion protein to the outer boundary of the cell. So they have created a protein antibody against the fusion protein. So the fusion protein doesn't change in any virus. Coronaviruses.
So do we have a name for this vaccine as yet?
They have not yet named the vaccine, but they have tried the vaccine on swines, and which is quite effective. And because the physiology and immunology system of swine is very close to the human beings.
So we shouldn't be very proud of ourselves when we think we are just
so
something.
So it will work in all the weather or in all the temperatures, and it will give protection against all sort of mutation, even future
mutation. This is
mutation.
very, very important.
It's very good thing which is going to happen in near future.
So because now we know that the Pfizer and Moderna cannot be used over here, those mRNA vaccines require extreme temperature, almost minus 70 degrees. So we don't have them here, and that's a very relatively newer technology that was not tried before. Then the AstraZeneca and the Johnson & Johnson that has been shown to have some kind of clotting is not being very popular as well. Those are viral vector vaccines where a chimpanzee or somebody or an adenovirus was used in the middle, right? And that is why that is believed to have created that kind of immune response. But we are lucky that we have the conventional Chinese vaccine that we have been using since ever. Like all our other diseases uses the same live or attenuated form of the germ itself to induce a sort of kind of antibody response in us, and so that our body identifies the enemy, and when the real enemy comes, we are able to fight it. And now we have Sputnik and this latest one as well. So what is your message to all the audience regarding vaccines? Because they're very scared of them. People don't know who should go for a vaccine and who should not go for a vaccine. Kindly could you elaborate that a bit? And
yes,
and just give you a departing message.
This is my message, and also I feel to convey that we should all go for the vaccine. Over 18 years of age, we should get a vaccine, because it will also protect us in minimum in 80% of the chances we will not get the virus. So sometimes recently we have seen that people are complaining that they got 2 shots, and even afterwards they got the coronaviruses. So then, even then, if you get the virus or you get the disease, that will be a milder form of the disease, not the severe form of the disease. And there will be lesser chances to transmit the disease to others. So this is why I would convey that we should all get the jabs of vaccine, and also we should we should not forget the SOPs like distancing, masking, and cleaning our hands and airing our environment.
And staying happy. Thank you so much, Dr. Rao Suhail, for coming over today. And you've heard it from the master himself. Stay happy, eat healthy, exercise, and go for your vaccination. There's nothing to feel scared of. If you're not allergic to any of those components and your healthcare practitioner suggests it to you, please go for it today. Thank you for watching us. See you tomorrow in yet another episode of Healthwise. Allah Hafiz.